hope you all are having a good start to your week. I had a really good week with my boys, and they are all now up at their dad's. This week is incredibly busy. I have 2 medical appointments, and then on Friday is my younger boys' last day of school. I was supposed to be off on a Friday, but we are still on mandatory overtime, and so I didn't want to lose any of that overtime money, especially in this economy. I think I say that in every video. So it's Friday morning is the award ceremony for the boys at school. I have never missed an award ceremony. My youngest is now in 9th grade. My second son is in 11th grade, and I've never missed an award ceremony. So I usually try to get the whole day off, but with our mandatory overtime, that was just not going to be possible. So I requested a schedule adjustment, and the 2 medical appointments that I have this week, I'm also doing a schedule adjustment, which means I'm just working extra hours to make up the time. So between yesterday and today, I've made up about 6 hours. And then I worked 1 hour of overtime. We are required to do 4 hours overtime a week. We found out on Friday that even with, if we have PTO, we still have to do the extra 4 hours. Then also with next week, is Memorial Day. We are still required to do our 4 hours, and we cannot work at all on Monday. So I'm off Friday for another medical appointment of that week. So I'm probably going to make up just those hours and just take the overtime pay, or the overtime is straight pay, since we're not allowed to technically make up those hours. So it's going to be an interesting few weeks. I have some coworkers that were hoping to take a lot of time off in June, and now we're trying to figure out how they can get all those hours. And between my full-time job and my part-time job, I inadvertently put myself on a 14-day stretch. So one good thing is, though, I'm about 9 days in. I worked my part-time job on Saturday, and then in order to make up the extra time for this week, I worked 5 hours yesterday. So it's going to be a crazy busy week, but the following Sunday I have nothing going on, so I'm looking forward to sleeping in and making sure everything's done before the boys get here that afternoon. And then Monday is Memorial Day, so that will be nice to have off. And Wilma has decided to join us. She wants to go outside onto the balcony, but it is really warm outside, so I'm kind of waiting until it's cooler. One of my medical appointments this week is my annual CT scan, so I thought this would be a good time to talk about those health issues I mentioned in previous videos. I get a yearly CT scan because in 2008 I was diagnosed with a rare tumor called a Desmoid, D-E-S-M-O-I-D. There is another tumor out there called a dermoid, D-E-R-M-O-I-D, and they get mixed up a lot. Dermoids are completely benign, and some radiology techs and other doctors that are not too experienced will often get dermoids and desmoids screwed up, and desmoids are much worse than what a dermoid is. So it's been interesting over the years, but like I said, in 2008 I was pregnant with my my second son, and I found a lump right here underneath my right breast. And because I was pregnant, I wasn't 100% concerned about it. Slightly concerned, just because with pregnancy things have a tendency to get a little discombobulated, and I wasn't really in any pain or anything. It was just kind of there. After my son was born, the lump was still there. So after forgetting to talk to my OB about the lump at a follow-up appointment, when I took my son in to our doctor, we go to a family practice. She is also certified in peds. So when I took him in for his infant appointment, I had asked the nurse if it was possible to discuss a personal health issue with the doctor, or if I should make an appointment. And I was told to ask the doctor. So when the doctor came in to examine my son, I had asked her, and she said no, that she had time. So she checked it out and decided I needed to have a CT scan. That was my very first CT scan I had ever had. We left that appointment with an order for CT scan myself. My son had some abnormal lab work at the hospital when he was born, so they wanted us to go and get that checked out. So I took him to the lab and got that done, and then my CT scan was later in the week. Like I said, that was my first CT scan ever. Because I was nursing, I ended up having to do what they call a pump and dump, which was not a lot of fun. But you have to make sure that you get all the chemicals out. They do put IV contrast in to make sure they can see all your organs and everything correctly. So it was very important to pump and dump. I found out, we got our results actually on the same day. My son's lab work came back fine. I got to talk to the nurse and found out those results. And then I found out that day that when they tell you the doctor needs to come on the phone to talk to you, it's usually not good news. So I waited for the doctor to get on the phone, and she told me that I had a desmoid tumor. At the time, I was not sure what to think. I never heard of desmoids. They are common in women that have had C-sections. Women and men both can get them. Desmoids are rare tumors. They're a connective tissue tumor. And at the time I was diagnosed, 2 to 4 people out of 1 million are diagnosed each year. Within the last few years, I think they changed that to 4 to 6 people out of 1 million. First diagnosed, desmoids were considered a benign tumor, but they did have a recurrence rate. I was originally told 20% recurrence. Ended up finding out through my own research that it was about 50 to 70% chance of recurrence. So in June of 2008, I had a surgery to remove my tumor. I felt lucky to be diagnosed as quickly as I was, because there are some people that are not diagnosed with desmoids until after they've already had the tumor removed. So it was good for me to have a diagnosis before that. I was treated for my tumor at the University of Pennsylvania Hospital in Philadelphia. At the time, originally I was recommended to go to, or referred to go to one of the local medical centers. And so that they went ahead and made the referral. And I heard back from them, and they weren't sure who they were going to schedule me with. So they were going to get back with me. So I ended up doing my own research and found the Desmoid Tumor Research Foundation. And they do a lot of the main research for desmoids. I forgot to mention that within the last 5 years, I believe, maybe a little bit longer, desmoids now are categorized as a soft tissue sarcoma. I have water up there, and I'm just making sure that she doesn't knock it down or drink from it. She likes to drink from cups of water. So it's now considered a form of cancer, but when I was, when I was diagnosed, it was not considered cancer yet. So I usually do not put cancer on my medical form, because when I was diagnosed, it was not considered cancer, so I was never officially given the cancer diagnosis. So as a connective tissue tumor, mine was in my abdominal wall. There are people that have gotten them on their face, anywhere their tissue connects. You can pretty much have a tumor. I know of people that have had them in their limbs, on their back. I've seen pictures of small children that have gotten the tumors. The hardest things with desmoids is it's hard to treat, because one person's tumor might not respond the same way that another person's tumor would respond. So like I said, I did some research on the Desmoid Tumor Research Foundation website and found out that the only hospitals in Pennsylvania recommended for desmoid tumors were the University of Pennsylvania Hospital in Philadelphia, Fox Chase, also in Philadelphia, and the University of Pittsburgh Hospital in, obviously, Pittsburgh. So at the time, we didn't know anybody that lived in Pittsburgh, so we rolled out UPMC and contacted, at the time, my now ex-husband's family had lived outside of Philadelphia, and so we had contacted them, and they did some research for us and said no to go to the University of Pennsylvania Hospital. So I called my family doctor and let them know what I had found out, and asked if they had ever done referrals to UPenn, and they were like, no, we haven't, but we absolutely will. So within a week, I had been scheduled to see their head surgeon for gastroenterology that was going to be handling my tumor. And then, which was funny because I had an appointment, everything set up, and then the previous medical center contacted me. They had somebody that they wanted for me to go see, and I basically turned down that appointment because I had already had an appointment set up with a specialist. So I went down to the University of Pennsylvania Hospital and had my first tumor resection there. My doctor is Dr. Jeffrey Drebin. He was a wonderful doctor, very good bedside manner. I think he had a lot of patients, so sometimes he couldn't remember our names. So he just called me my lady, which was a lot of fun. So he was really nice. UPenn is also a teaching hospital, so I got to know some of the residents that were coming in and checking on me after my surgery. I was in the hospital for a week, and then I came home to a toddler and an infant, which was interesting. My mom was still alive at the time, so she did help me as much as she could. In 2009, I had a recurrence, and I have to back up a little bit. I was supposed to have radiation after the first tumor was removed, but the radiation oncologist that I was referred to was concerned because I was 36 at the time, and one of the side effects for radiation, is actually cancer. So he was concerned about that. My then husband was also concerned about the radiation. So I did not get radiation at the time. The following year, was having a lot of pain in the surgical site, was really getting concerned, contacted my family doctor who suggested I contact the oncologist, and so went down and had an MRI and found out that the tumor did indeed come back. This time it was slightly lower than the first one, and it was sitting on a rib. So we went ahead and did 6 weeks of radiation, 5 days a week. I was very grateful. The people from my church really stepped up, not only after my first surgery with meals, but when I had my radiation, they came out and helped with rides to the radiation center, meals. I think there was only one time I actually had to drive myself for an appointment because there was a scheduling issue. So they were very helpful in that. So I had the radiation, and like I said, no tumor acts alike. And so radiation, although it's been helpful for other people, the radiation angered my tumor, and it actually grew. And so in October of 2009, I had my second tumor resection. I was supposed to originally have it done in September, but the surgeon had a death in the family, and so they had to reschedule. Between August and September, when I had, August and October, when I had, from my last MRI to October when I had my surgery, the tumor had grown into my liver and my gallbladder. So when they did the tumor resection, they took out my gallbladder and 20% of my liver. Your liver does regenerate itself. So that was not what I was expecting. It was more than what was planned for. So I went home and again had young children, and so the church did come in and help again and helped with meals and different things. So that was greatly appreciated. And so I have been tumor-free since 2009. My tumor was idiopathic. I forgot to mention there is a health issue called FAP. I think it's familia paplona, something, where desmoids are almost a side effect of FAP. So there is no, I don't have any family that has FAP. So they rolled that out. Crohn's does run in my family, so there was some speculation of maybe the Crohn's disease had mutated into a tumor. At this point, we're not sure. So my tumor was considered idiopathic. So I have not had a recurrence, and a large part of that is because when they know that you do have a desmoid and you do have surgery, they try to get what they call clear margins. So in order to get clear margins with my second tumor, they took out 3 additional ribs, and then so that way there was no hopes that it did not come back. Like I said, I have not been tumor free, and so that has been good. But I do go yearly for a CT scan because there is still that recurrence rate. I know of a woman who had a desmoid tumor that went 12 years tumor free, and then as soon as she entered menopause, she ended up having a new tumor. So I just prefer to get that monitoring CT done. I prefer CTs over MRIs. CT I can be in and out in 15 minutes. MRIs for me take about an hour and a half. For both tests, I do there's points in time where I'm not allowed to breathe, and the times with the MRI seem to be longer. And I've had some really good MRI techs that were very kind and helpful in helping me find the best ways to hold my breath. I've had MRI techs that were very rude and mean, and so I would rather risk the radiation of a CT and be in and out in 15 minutes than to go through an MRI machine. I'm not claustrophobic, it's just the length of time is very different. So I still get that done. Unfortunately, although I'm tumor free, I've had issues with hernias. A large part of that is because my tumors had been in my abdominal wall. So in order to resect those tumors, remove those, they had to take a large part of my abdominal wall out. And so my abdominal wall is built with mesh on my right side. And a large problem too with my hernias is I didn't always have a lot of help. If I had help, it was for short periods of time. In my household, I was kind of expected as soon as I got home from the hospital to go back to the regular wife duties of cleaning the house, cooking, taking care of the kids. My then husband worked a modified second shift, so I would take care of the kids pretty much on my own. I was one of those married single moms, and so I didn't always have a lot of help, and didn't really have a lot of time to rest and recover. So I am now on hernia number 4. The first 2 hernias were repaired at the University of Pennsylvania Hospital. The first one was with Dr. Drubbin, who was my same doctor who did my tumor surgeries. People were surprised that he was doing a hernia until they heard the backstory, and then they realized that I had an odd situation. So they completely understood that he repaired my first hernia. He had since left the hospital, and he's now up at a hospital in New York. I try and follow where my doctors are because you never know when you need to go back to them. My second tumor I had my second hernia I had for 6 years. I was diagnosed, the first hernia repair was in 2012. I was diagnosed with another hernia in 2013. And 2014. I had that hernia for 6 years before I had it repaired. I had it monitored with the CT scan that I get for the tumor. My doctor did follow me pretty closely. The only reason I ended up having to get that one repaired in 2020, right in the middle of COVID, I actually had to go down early to the hospital and take a COVID test before they did the surgery to make sure I was clear. So I had that done at the University of Pennsylvania Hospital. Like I said, my doctor had since left. I found out they had a full team of hernia specialists, and so I went down and had an appointment with a specialist and with the plastic surgeon who was going to do my closures. I had a lot of scars at that point, so they actually fixed my scars too. And then, unfortunately, in 2021, I was diagnosed with another hernia. And at that point, I was working for the company I'm working with now. And because my current company and the University of Pennsylvania Hospital are competitors, they did not take my insurance. Because I had seen them in the past, there was possibly of a workaround. But, and the workaround was going to be kind of complicated, so I decided to go with my current medical center. And I ended up seeing a hernia specialist. And he had actually done his residency at the Cleveland Clinic in, obviously, Cleveland, Ohio. And so he sent me out there, and I saw I'm assuming he's still listed as the #1 hernia specialist in the country. So I got to see Dr. Michael Rosen. Also, wonderful doctor, very good bedside manner, very knowledgeable. So I had my third hernia repaired at the Cleveland Clinic, and one of the things with that was, because I was coming out of state, he wanted me to stay local. So I was actually in Ohio for about a month, 1 week in a maybe a week and a half in a hospital. And then I was fortunate. I had some friends that were from the Cleveland area that I had known since 1998. They had actually been my host family when I went on my internship in Michigan. And they're now back in Ohio, and so they graciously allowed me to come and stay with them for those additional 3 weeks. That was just a blessing, just an amazing blessing. I had made plans to stay at an Airbnb, which ended up not working out. The pictures that were on the Airbnb site, I discovered once I got there, were very old, and it was kind of a hostel setup where everybody had their own room, but you had to share a bathroom. The bathroom had one single lock that didn't look very safe, and there was a lot of men staying there also, and so as a single female, I was a little concerned about staying there. There were also gunshots during the middle of the night, my first night there, so just decided it was not safe to stay there. I did not have a vehicle, so I would have to be walking everywhere. And so I took an Uber back to the hospital and contacted my friends, and they were just absolutely willing. They came in and got me. So that was just so very appreciative. I was going to mention something else, and now I forgot what it was. Okay. Well, if I think of it, I will tell you. So that was hernia number 3. Last year, I was diagnosed with hernia number 4, which is right here. And so next week, I have a appointment with the same surgeon I saw in 2021 with the medical center that I work with. I am hoping not to get back to the Cleveland Clinic, largely because, as I said, that doctor has since moved on. And, I remember what it was. I also don't want to go back to Cleveland Clinic because I had a really hard time getting out there and getting back home, as no one was willing to take me. So I took the train from Lewistown, PA, to Cleveland, and I moved all my baggage with me. I found out what happens when you go to a surgery by yourself. They look at you like they look at you very sad. A lot of people don't come into surgeries by themselves. So I did give them my sister's cell number. She was my emergency contact. I found out that if you come to a surgery by yourself, they do call security to come and get your things. And so that's what they did with me. So when I came through my surgery and into recovery room, my bags and suitcase were waiting for me in my room. So I've survived a major surgery by myself. So I always say if I can survive a major surgery, I can pretty much survive anything. But as I said, I really am hoping not to have to go back out to the Cleveland Clinic because it's too far It's only 4.5 hours, but I really don't want to have to take the train again. It was a good experience. Taking the train was a wonderful experience. It's a lot after surgery. Trying to maneuver my baggage, and trying to make it home. And then at the time, we were doing an in-house separation, and the divorce wasn't final yet. So, like I said, I was pretty much expected to get back and get things done. It took me a couple of weeks just to get the house back in order, because I could only do so much at a time before I ran out of stamina. So if I have to have another surgery, I'm planning on getting everything taken care of before I have it. That way I can come up my apartment and it will be nice and clean, and I don't need to worry about playing catch up. So I see the surgeon next week. Hoping I can get by without surgery right away, just for the fact that right now I can't, as I need to work 2 jobs, being off for surgery, and typically in the past I've been off for 8 weeks. With my second tumor, I was off for 3 months because I did have some complications, which I really didn't get into, but there's no reason to make this a long video. So, being off for 8 weeks, I'm really concerned about being able to pay my bills. So if I have to have surgery right away, I'm really hoping, because I do work from home, there's no heavy lifting. I pretty much sit at a desk or stand at my desk, because I can do both. That maybe I can get by without a long medical leave, because I really don't know how I'd be able to afford my bills if I had to go on a longer leave. So we'll see what happens. I specifically set up my CT scan for prior to my surgery appointment, surgery consult, I should say. That way they can see the scan and decide what they need to do. Last year's scan showed, because of the hernia, that my colon is not in the right areas. So I'm hoping that there's not major issues when they look at the scan. And maybe I can get by a little bit longer without having surgery, but we'll have to see. I've had pain every day probably since 2009. I say there's good pain days and there are bad pain days. So today's a normal pain day. So I have pain around the hernia area. So we'll have to see what happens. Since it is my week when I have my appointment with the surgeon, I am taking the boys with me, so the plan is to go down the night before my appointment and then get a hotel, and they'll hang out at the hotel where I have my appointment, and then we're going to hang out around the area. My appointment's in Harrisburg, so I had lived in that area for 5 years in the early 2000s, and so we're going to kind of take like a mini vacation and go down there and see the sights, and then depending on what my oldest son's work schedule is, we'll either come home that Friday night or we'll wait and come back home Saturday morning. So those are the main things going on with me right now. I think I did mention at one point that I was diagnosed with Hashimoto's in 2024 through blood tests. My T3 is an issue, so it doesn't come out in the regular thyroid tests. Unfortunately, with how much things cost, I have not been able to treat that. So I've just been, I kind of say dealing with the symptoms, but I don't know how, I only know how I feel with the symptoms of Hashimoto's. So I am hoping to be able to start a different nutrition plan and hopefully start to feel better and actually know exactly how I feel when I'm not symptomatic. I hope that makes sense. So with Hashimoto's, it's no dairy and no gluten, which I have cut out a lot of dairy and gluten, but I haven't cut out everything. So my plan is to start working and cutting more dairy and gluten out. I did purchase some non-gluten flour. Try and make some things by myself because gluten-free things at the stores is super expensive. I've also started working with a health coach, so that's going to be very helpful in trying to figure out nutrition plans. And I think I mentioned in a previous video, unless I edited that out, I'm not sure, that she, exercise-wise, she thinks I'm doing very well. I walk at least twice a day, sometimes 3 times a day. 2 days a week I am doing yoga, Pilates, Tai Chi. I was lifting weights, but I've decided to take a break from lifting the weights for right now. Just until I find out what's going on with the hernia. I do have an abdominal binder that I can wear when I do lift weights. So hopefully once we figure out what's going on with the hernia, then I can start working towards taking care of these other health issues. I also want to get rid of this extra weight, as I have a lot of issues with inflammation. So I'm also printing out some nutrition plans to help with the inflammation and not eat things that might trigger that, which is also dairy and gluten. So I hope you all have a good week. Like I said, this will probably be my only video this week, just for the fact that it's crazy busy. Also, I am finding I am a person of routine, and so the week-long vlogs aren't gonna work for me, just for the fact that I don't want to bore anybody with my weekly reset cleaning on Mondays and cleaning on Saturdays before the boys come back, and shopping. Wednesdays are my community groups, so my schedule's pretty much regimented, so trying to find time to film sometimes makes it rough, and I don't want to bore people with the same activities week after week after week. So the vlogs will be as the same schedule. I will planning very much to do a vlog 1 week, and then like I said, either a hiking video or cooking or something the following week. So the vlogs will be every other week. So thank you for so much for tuning in and watching. I greatly appreciate it. If this is something that you're interested in, please push the subscribe button, and I'll see you on the next one. Thank you.